Good morning, everyone. Thanks for joining us. It's an exciting day. It's really an historic day. We have not done mass vaccination for a number of years in this county, and it's my first go-around with this. First, I want to paint the picture. We are in the middle of a global pandemic. There are more than 20 million Americans who have been confirmed to have this disease. Limited by our vaccine supply at this point. We expect our supply chain to be increased. We expect our allocation to increase, and we stand ready to deliver those vaccines. We want to get lots of shots in arms because what we know of these two vaccines is they are spectacular in stopping severe disease and stopping hospitalizations. What we don't know is, do they stop transmission? And those studies are being done right now. But in the meantime, even people who are vaccinated still need to wear a mask, still need to do social distancing. However, what a relief for people who are able to get the vaccine to know that their chances of being hospitalized or dying of this deadly virus go to almost zero. So, I got my vaccine. I've had my 2 shots as an emergency physician. I got my last one on Friday. And 7 days after the second shot is when we really know our immunity is there. So that's the background. That's really the hope. This is, in my opinion, the way out of this crisis. This is the way we get back to a near normal, is by getting vaccines in arms, by getting people vaccinated. And ideally, what we hope for is this population immunity or herd immunity. So that's what I want to say about that. I want to turn it over to Mindy Waldron, who's going to talk a lot about our department and also about the operation here, and then we'll be happy to give a tour to kind of walk through what's going to be happening here. We'll take questions after.
So, good morning. I'm Mindy Waldron. I'm the department administrator. And as Dr. Sutter said, this is an historic day here for Allen County for our department, where we join the hospitals in being able to provide COVID-19 vaccine. The past 10 months have been very difficult ones for us, as well as the community, the world as a whole. We understand. That's why we're very excited to be able to bring this today and be able to open tomorrow. I'm also excited to announce that we are fully booked almost for this week and well into next week. So there is a lot of need, and we're very happy to see that. On Sunday, I hit my 25th year here and 31st year overall. And all we have done since the beginning, one of the bigger things was you need to prepare. You need to prepare for the next pandemic. You need to be able to do mass medication, mass vaccination. So we've always prepared every year. We've prepared with this particular building as well. So we come to this day where now we are putting it into full force and doing what we have planned for almost 30 years here locally. So is that a good thing? It's a good thing that we're prepared, and it's a good thing that we have vaccine to start tomorrow. So before I give a few acknowledgments, I want to talk just a little bit about some benchmarks that we have hit over these last 10 months. I'll share our plan of what we're going to do here, and then as Dr. Sutter said, we'll take a tour, give you a sneak peek. So in the past 10 months, we've contact traced nearly 31,000 cases here in Allen County alone. with a team of less than 10 working 7 days a week for the past 10 months. Started 2 COVID testing sites from the ground up with no experience in doing that type of testing, and we've tested over 15,000 people since October 1. We've provided 317 press releases, nearly one a day, and conducted 272 media interviews at any time requested to keep the community and everyone, you included, understanding where we were at every juncture in this journey. We've hired nearly 40 temporary staff in the last 6 months to help with contact tracing, testing, and now for this vaccination site, so that when we do get more vaccine allotment amounts, we can quickly pivot to bring more on board and bring our appointments up. Everything is contingent on the amount we get. We will attempt to max out every dose that we get each week. That is our hope. So having people on standby and trained and sort of seasoned in our software system that we got 2 days ago is a journey in and of itself. But we're getting there. So we've answered also 9,000 calls in just the last 9 months on the 5 hotlines that we have for a variety of topics. We have also responded to 2,200 complaints on just the governor's orders alone. So most of our inspectors, that's what they do. They don't do their regular jobs, they do complaint inspections to try and at least get us to where we need to be safety-wise and as much consistency as we can. And all in all, our staff just on COVID-19 in the past 10 months have worked 22,500 hours, as well as then their duties after that. 22,500 just is COVID. And I can't begin to explain, and I'm sure Dr. Sutter would agree, that we are blessed with our team. Our team has done whatever we have asked them, whenever we have asked them, 7 days a week, no questions, no pushback. And they'll continue that for the next, hopefully, several months till we get through this phase. We're just very blessed to have them. Our division directors, our leaders, they have taken the larger load in the planning and the doing, and not doing just their job, but whatever we asked. So we've just been so lucky to have them. And I want to say a few thanks to a few folks or entities without whom we would not be here today, where we're at and ready to move forward. First, Dr. Sutter, because I really want to say thanks to him for joining us during the busiest public health time ever. Coming aboard, having knowledge already, which was super helpful, and become part of the team, our duo, and that I rely on and trust, and his ability to keep what up here he can say to me anything about COVID at any time is so helpful from a medical standpoint. So I thank you, I honestly do. Allen County Commissioners and all of their staff, Mayors Tom Henry and Steve McMichael, fantastic after-hours responding attorney Laura Mazer, our Allen County Council, Bernie Beyer, Chris Fleischer with Homeland Security, a lot of behind-the-scenes work, coordination, helping me gather things, delivering things, kind of keeping me informed on things that we don't always hear. Scott Burning, Marty Bender, Chief Reed with Fort Wayne Police Department, number of things that they've done for us for the last 10 months, and we'll continue with that. Chief Leahy, those with the Fort Wayne Fire Department, all the folks at Aging and In-Home Services of Northeast Indiana, they gave us one of our test sites for free and had a person that was at our beck and call for nearly 24/7. His name was Jason, a rock star. We wouldn't have had that second site without that because we had difficulty meeting all of the requirements for that. Our executive board for their support and their guidance, their feedback. AWS Foundation, St. Joseph Community Health Foundation, United Way, Community Foundation, and likely many more here soon that will support this operation. We could not be here without them. Connie Heflin at SuperShot for taking all childhood vaccinations for the foreseeable future off of our plate so that we could bring all of our vaccination staff here to rock it out here. Parkview Health and Lutheran Health Network. You might know, and I'm sure you do if you cover a lot of other counties and areas, it's not always the way it is here, where everyone works together. It's collaborative. We talk all the time. The hospital systems work together. They plan together. They have a common goal, and they include us. So including a local health department in the medical arena is not what it is everywhere. So we have been blessed that from the beginning of this, and basically with any issue we've ever had, they have been collaborative, and it is a team goal. For me personally, I'd really like to thank everybody that sent kind words of support to our department and myself, over this last year. And I thank them all because it's been a difficult thing to do what we've done, and all of us have received very nice comments, cards, things like that, and that's really what's kept us going. And last but not, and certainly not least though, are the folks here, Randy Brown, Gene Langwell, all the folks with his team here at the Coliseum. Because it's one thing to plan and talk about where you'll do something and how it might be set up. It's another thing to say, hey, can we come in for 6 months and can you set everything up every day and everything that we need, and can you provide some staff to help us? And they've done that. They have been the most accommodating group, and it's a lot. It's a lot of stress involved with setting something like this up, and they have accommodated immediately. And we'll be here for a while, and so thanks to their team, because we do not have another site like this. Allen County is very blessed to be able to expand when we get more vaccine. There was talk yesterday about some sites might need to move. They're a little small. And we had that if we would have to use any of our buildings. Here, we will not. We will be able to expand, and so we are incredibly blessed with that. So let's talk about what's going to start tomorrow, what's going to happen. Our mass vaccination clinic will start tomorrow. We will operate with 4 days a week to start, which will be Wednesdays through Saturdays. We will have evening hours, weekday hours, and weekend hours. I'm not sure if I said that correctly, after hours as well. And then we will expand by adding staff and days and hours as we get more vaccine, and we'll announce those to you, just like we have announced how many cases we have. We will announce when we move up. We are suited here, though, to move very quickly over the next few weeks. For the next 2 to 3 weeks, it will be that 4-day schedule. And then as things increase, we will add and notify you. Across the state, so it's no different here, everything will be done by appointment, whether they schedule online or via the 211 call-in system to make their appointment and register, and we highly encourage folks to fully register. It takes many minutes longer per person when we have to register you here. So when you make that appointment, register. Fill in all of those blanks so that our staff can move quickly and we can get folks through the line. That is done through www.ourshot.in.gov or by calling 211, as I said. We will not be taking walk-in appointments at this time, maybe in a few months, but at this time everything is accounted for, and we are doing it in the way that the state has requested that we do. And we will always follow the state required prioritizations or the eligibilities. We will not stray from that. We will stick to those as best we can. And so for the most popular questions that we're getting now, thought it might help you to lay those out. People do need to bring their photo ID. If they are here for a work reason, in other words, their profession makes them eligible, we'll need their work ID. We will also need insurance information. Insurance is being billed for only the administration fee by the state, not by us, and it is to help keep us all in operation. There will be no bill to the patient, no back billing. It is free, but they will bill for the administration fee, so we'll need to see insurance. If someone does not have insurance, it does not kick them out. It is not a problem to proceed. And then they will need to bring their, I forgot the third thing. I think that's right. As I said, we will not do walk-ins, nor will we reschedule anybody that shows up with an appointment for another day. Everything is very regimented as to how many doses we have and who those are for that day, so we can't jockey around with that very much. So we hope folks that will pay attention to when their reservation is, that they would get a link to remind them, and look at that to be sure you're coming on the right day. Folks cannot come to the Coliseum or to any of our departments physically to be registered or to make appointments. Those are only online or by that 211 call center. At the time of the first appointment, like the hospitals have done, we will reschedule that second dose. It's about 28 days for Moderna, and Moderna is the only vaccine that we will be providing here. So we will reschedule that at that time for as close as we possibly can to that 28th day mark. The wait times should not be substantial. As you'll see, we're well suited in the size area and hopefully with the staff as well. But we are working behind the scenes, and we probably can expect a few glitches on our first few days, so we ask folks to be patient as we work through that. We have backup plans, so we can switch to those if we need to move people through. As I said, the vaccine is free. Dr. Sutter and I will be glad to take any of the questions that you might have right now. We'll take a few now. We'll do the tour, which will be a guided tour. Nobody strays. Nobody goes into any curtains that we don't say you can. So you'll stick with us. We'll stop at each juncture so that you can do any B-roll or ask any little questions about the areas. Once we work through that and get to the last section, we'll come back out here and do site interviews, okay? And then I need to get that secured so we can get back to work. So if you have any questions now, we'd be glad to take them. Obviously, Dr. Sutter will answer a little bit more on the vaccine side, and I'll talk operations. Corinne?
An operations question. People aging and older may have mobility issues and or cognitive issues. Will somebody be allowed to accompany them to their appointment?
Very good question, and absolutely. We hope folks do come with a caregiver if they need that, no problem. We hope to have a slight plan for also helping them along in a wheelchair if needed. But yes, they can have someone escort them through the entire way.
Question about the rollout for the Sutter. With the change of what's happening at the national level and administration's changing, do we expect that to change the state's plan and then how we do things in the next couple of weeks? Are we anticipating this stand to stick or the plan to stay in place for a while?
And so it's difficult to predict exactly how that will roll out. We do expect to see increasing doses both from supply chain and also from more being released at the national level, but we don't have any indication as to what those numbers are yet. The bigger piece is we stand prepared. So as soon as we start seeing more doses, we can start giving more doses.
Do you think we'll be in red for a while now? Or any concerns of going back and forth with people being able to keep track of those restrictions?
Yeah, it's confusing to go back and forth between red and orange, and we've been kind of right on that boundary. One of the things we do is that in order to go down a level, you have to be in orange or a lower level for 2 weeks before we drop back down. I'm hopeful that we go back to orange. So that's not necessarily a bad thing, but right now I'm concerned because our positivity rate keeps going up and keeps climbing. This may be just a bump and then we're back down to a lower level, but our amount of community spread is still very, very high. We are firmly in the red with that particular metric. And so then it's just the positivity. And a 15% positivity rate is a very, very high number. We'd really like it below 5%. And we're miles away from that.
Are there any concern with surrounding counties as well with the size of the community spread?
Yeah, so the local health officers in the surrounding counties have, in general, put similar orders in place. And the governor's executive order is the primary one, which covers, obviously, the entire state.
You've been in touch with people from other counties?
Yeah, we've been communicating and collaborating. I'll let you answer that.
It will change each week. What we will have for the first week, 2 weeks, is an approximate 800 doses per week. We have the ability, we believe, to, at some point, vaccinate between 1,200 and 1,400 a day. So we have quite a bit of capacity to move up if the vaccine moves up with us. Each week we will learn, so I don't have any beyond that. Rosa?
You talked about only scheduling online when someone comes in for their first dose. Are you automatically scheduling them for their second dose that day, or do they have to go back?
Correct. As I said, we will schedule at that visit when they check in. We will automatically schedule their second visit for them so that they don't have to navigate that again.
With the new strain, the UK strain, the state, do you have any concerns about it becoming more?
Yeah, so there have been reports that the B.1.1.7 variant has been found in Indiana. It's commonly called the UK strain because that's where it was first found. It's not really clear that it originated there. They were just doing more sequencing than anybody else, so they found it first. There is certainly speculation that this is a more infectious variant, although that's just based on clustering of cases, and we don't really have the biologic data to confirm that yet. Regardless of whether the infectious rate is the same or whether it's higher, SARS-CoV-2 is an incredibly infectious virus. We can see that this year because our flu levels are so low, because masks and social distancing help with respiratory viruses. And SARS-CoV-2 is more infectious than influenza. So even if it is substantially more infectious, what we do is the same. Wear a mask, social distancing, washing your hands, avoiding large crowds, and getting vaccinated. And the early reports suggest, and we've got every reason to think, that these vaccines will continue to work as the virus mutates. This virus will continue to mutate because it's what viruses do. However, it mutates relatively slowly compared to other ones. But the vaccines appear effective. We expect them to continue to be effective. And if they become ineffective, mRNA vaccines are relatively easy to tweak, to change, to address that. So I don't see big changes. It's possible that this will increase our case counts if it is more infectious. But what we do and our response to it is the same. However, if people are worried about that, it's a great reason to get a vaccine.
Is there a question why Moderna was chosen?
Yeah, so the two vaccines that are available right now are Moderna and Pfizer. Pfizer requires ultra-cold storage, and currently we and most other local health departments don't have access to that. Now, functionally, the viruses are the same. They're structured the same. I can't find any appreciable differences between the two, so I don't think that that's a big deal. The Moderna strain has been phenomenal at stopping severe disease and stopping hospitalization. Yeah, most places, in fact, I think all places currently, when you get your first vaccine, they're making you an appointment for the second vaccine. Now, if something changes with that, there's no prohibition on that. They can get it anywhere in the state. But in general, people are getting it in the same place. 800 a week.
To start, it's low. We want to move it up.
But that's the vial, right?
No, the vials are 10-dose vials. So we'll be able to do 800 doses, 800 people a
I thought
week.
you said something 12 to 1400.
We have the capacity, if they give us more vaccine, to be able to vaccinate 1,200 to 1,400 a day if we need to. That will be down the road.
With the Pfizer vaccine, people were being asked to sit and wait for 15 minutes before the need.
Yeah, so both the mRNA vaccines have had people experience anaphylaxis or severe allergic reactions afterwards. This has been relatively rare. Out of the first 2 million doses, there were 11 cases of this. So that's about 1 in 190,000. However, it does happen, and we're taking every precaution. So most people wait 15 minutes after the vaccine. People who are at high risk, people have had anaphylaxis minutes afterwards as a precaution.
That is just this location. Yeah, and just to clarify, if somebody gets a vaccine at a hospital, they'll likely have to get their second one there because we won't have the same vaccine. So just so that's clear.
Yeah, most of the hospitals are giving Pfizer. A couple are giving Moderna, though. So. I'm gonna let you answer that
Oh, sure.
one.
Yes, there's no restriction on county. We can vaccinate folks that might work here but live in another state, but we cannot vaccinate folks who live in another state and do not work here. So no county restrictions within Indiana, but other states, they would have to work here and have ability to prove that. Any other questions, or are you ready for the tour? Tour? All right.